We have a topic that I consider to be very, very important, especially in the stage of the development of the medical cannabis market here in Europe right now. Of course, a lot of people are looking at what's going to happen with rec and how the market's going to evolve. But we're here to talk about the medical market and the patient experience. And I think that we can't forget that with everything that's going on. So without further ado, I'm going to start by just giving a little intro of the gentlemen to the left of me. First of all, we have Dr. Julian Wichmann next to me, co-founder of the Bloomwell Group and also Algea Care. And next to him, we have Barinder Bular, Senior VP of Corporate Affairs at Brains Bioceuticals, joining us all the way from Vancouver today. Next to Barinder, we have Stefan Verbeek, who is the president and CEO of Hello Cannabis, also coming from Canada today, joining us out of the GTA, the Greater Toronto Area. And last but not least, at the end, we have Dr. Jean-Claude Chicluna, who is the co-founder and chief science officer of Celotex. So I'm just going to get right into it. Gentlemen, I would like to know, what can we do right now to improve the access to medical cannabis for patients and improve the patient journey? What can we do right now to make things better for them?
Maybe just start from left to right, or whatever direction. So we're focused obviously on Germany, and one of the largest telemedicine platforms there. And I think it's shifting towards convenience. So it needs to be much easier to be a cannabis patient. I think in the past we had an issue of, I need to go to a doctor there, then I need to go to a pharmacy there, then there's an issue, I keep going back and forth. I think that's not only limiting I think it's taking a lot of time for patients. I think it's frustrating for patients, but it's also blocking people from considering becoming a cannabis patient. So our focus is really invest heavily and build up in tech and also the operations in the background. And I'm glad to say that now in Germany, which was unheard of before, we have, through our Bloomwell Group footprint, we have the first patients with video consultation on their phone on a Monday, and less than 24 hours, they have the cannabis medication in their hand, and it used to be days or not even weeks.
I think one of the biggest challenges right now is that there's no streamlined regulations. Nobody understands what a medical patient is. If you went out and talked to 50 people and asked them to describe medical cannabis, you will probably get 50 or 60 different opinions on what it is. So education has to be a real key figure here to ensure that our physicians, regulators can streamline regulations, because jurisdictionally people don't understand it. Within the country, people don't understand it. And then the other key is it's going to be access. Where can I get the medicines? Is it going to be through a specialist? Is it through a regular doctor? Is it through a pharmacy? Do I have to go online and get it? So I think education backed by evidence and science is going to be huge, so that regulators, physicians can feel comfortable knowing. But that education for consumers also is going to be a huge key.
I love it. I'm going to follow up on that as well and really reiterate the educational aspect of it. One of the first priorities that we did was to start educating physicians. Thankfully, we had a very strong network of doctors we worked with in Ontario, and one by one we were able to communicate with them and showing real patients, not stoners, and try and destigmatize cannabis use as a medicine. That type of education was able to kind of lead a pathway for doctors to become more comfortable prescribing a narcotic that at one point they thought turned you into a pizza-eating video gamer. That's clearly not the case, and that education, I think, was pivotal in being able to help increase the amount of physicians prescribing from 4% in Canada to north of 30% in a matter of about 4 years. To reiterate the second topic as well, we need to look at actual standardization here. There's an interesting issue here, is because cannabis, although it is a narcotic, it is not prescribed and treated and consumed similar to other narcotics. In Canada, we have something called a DIN, a drug identification number, which is what's required in order to be able to have this listed in pharmacies. So unfortunately, even though it is a narcotic that is prescribed, the access to it has this whole separate tags of a path that you need to walk down. It is not as simple as seeing a doctor, getting a prescription, and going to a pharmacy and picking up. So there's this weird stigma that's still there because it is treated differently. So if we're able to educate doctors, educate patients, and then standardize the medicine and the practice of distributing it, treating it like everything else, I think you'll see a much more rapid expansion of medical cannabis use and access.
I think we need to think of cannabis medicine as other medicine. And the way to improve patient outcomes is to foster a personal relationship based on trust. And how do we do that? The way we do that is we need to give patients the time of day. The time of day to talk about a medicine which is different from other medicines they've encountered. A type of medicine which doesn't attack just one system in the body, it's holistic, it's organic, and it doesn't just affect them in one part of their lives, but in many different parts of their lives. And ultimately, we need to remember that medical cannabis will have the same issues as medicine and the healthcare sector in general. So just to take possibly a different approach, we need to look at the healthcare sector and what is happening there. And we've just had a pandemic, right? So this is also on the cannabis patients' minds of going to their doctors. And especially when you have a choice, because in other aspects, if you're sick and you need a certain type of medicine, what you're going to do? You're going to go to the doctor. In cannabis, there's a choice. I can go to a doctor, but I can get it from my plug. So what is the added benefit of going to the doctor? And I think we need to, as clinicians and as anyone in the industry, we need to think about the patient's point of view, and we need to add value to making medical cannabis really medical. And adding that value, it takes time. It takes a lot of time, and it needs to be tackled in a different way from the way that medicine is being tackled currently. And it needs to be patient-centric. We look at the patient, and I like how medicine ties in with the cannabis industry and medical cannabis. There was a panel before this, a great one, the one about branding. And Jamie said in branding, you need to start backwards. Like in cannabis, you have to start with the consumer, see what they like, and work backwards. And in medical cannabis, it's just the same thing. We need to start with the patient, see what they like, and work backwards, not the hospital or the institution or the clinic.
Absolutely, that's a very great point. I think one thing also is one of the benefits with this active dialogue surrounding the legalization of recreational cannabis is that one of the derivatives is that it's becoming maybe less stigmatized slightly. So physicians are maybe more open to having these conversations, but also I don't want to discount, and I would like to highlight the role of pharmacists in this constellation, because oftentimes the pharmacists are a little more accessible to the patients than the physicians are. And I mean, you guys mentioned it, education. It's required. Now, to improve the patient experience, you really also have to improve the physician experience. In Germany, it's quite complex for a physician to prescribe medical cannabis to a patient. There's a lot of steps required, a lot of work that needs to be done. What are some of the barriers to entry, or let's say the hurdles of physicians when considering to integrate medical cannabis into their practice? And what can we do to tackle some of those things so that we can increase access for the patients by making the job of the physician easier?
I just want to focus on some of those. I think there's many more hurdles, especially bureaucratic hurdles. And I say this every year, making it easier for a doctor and a patient maybe means breaking with cannabis culture in a way. Meaning, strain names, etc., are, I think, important when developing new products. But as a doctor, if you need to use 3 lines on your prescription just for one medication, that's a hassle. So we're very, not only experienced, but we're also still advocating. You need simple product names. You need, as a vendor, you need a portfolio that has an instinctive understanding of, what's a high grade, what's a low intensity, etc. product in those ways. And I think this is a trend that is still happening in Germany, but it's bad from a doctor's perspective. And I don't mean me, I mean treating doctors in Germany. If you introduce products to the market and you already know you're going to take it off the market in 3 months, I think that works for certain kinetics, but for the majority of doctors, and especially in the future market, so in a restructured market, in an RX market, in a non-narcotic market, persistency, consistency with product availability, product stability and quality, but also pricing in the pharmacies is very important. I think when you look at Germany, and if you look at especially privately insured patient self-pay market, which is the only growing market, it's crucial to understand that even the doctors know the prices in the pharmacies, and they look at it because it's in the best interest of their patients. So I think it's very, especially as Jean-Claude already said, cannabis is very much different, and there's an overlap of medicine, but also from a doctor's perspective, many things are completely new topics when you're treating patients. Suddenly you have to look at inventory and prices and availability at pharmacies.
I think one of the things for physicians is we need to equip them with evidence, science, and data so that they have the confidence prescribing and they know what dosage forms they're prescribing. So that only can happen if industry and companies are providing the right compounds, the consistent API quality active ingredients for clinical studies so that the physicians do have the confidence. They know the dosages, they know where they're going. I mean, it is a tragedy if you look at it. Some jurisdictions in the UK, in Europe, less than 10% of the registered patients are getting access to these medicines. But what's important, I think, is to breaking it down to, one, the molecule first, understanding what the different compounds are, then having that a clinical background studied so that then the physicians have the confidence to know what they're prescribing. Also, physicians will need to know, are there harms? Are there side effects? Just like at the end of pharmaceutical drug, if we're going to prescribe these things, we need to know that. And the physicians need to have the confidence to do that so that they can build trust and continue to do this. So those are two very important points from my perspective to increase the physician recognition of this.
Yeah, it's quite fascinating when we saw recreational come out in Canada. Canada's been a large consumer of cannabis for quite some time. I'd like to think that outside of the physicians, the cannabis use has been largely destigmatized in our country. When we started introducing it as a medicine, I myself was actually quite surprised for that. A quick backstory: I'm a Dutch guy from Vancouver, which I think are like the two largest cannabis consuming areas in the world, and I had never thought of this as a medicine until I suffered a very extreme injury, and it was through a synthetic opioid addiction from post-surgery that I discovered using cannabis as a medicine. And when we introduced recreational cannabis, it kind of created this very interesting overlap between what is medicine and what is recreational use. And I'll publicly admit that I am both a medical user and a recreational user, and I do believe that there's two distinct uses and two distinct different purposes for it. As much as there is an overlap, I think this is something that we need to really, really, really look at here. It does actually confuse a lot of physicians when they see patients that actually are able to consume it on a recreational side. And it does also create some confusion with respect to when they're prescribing as well. If you were to look at it with respect to an opioid, say like Dilaudid or Percocets or Oxycontin, people that use those recreationally, there's a big stigma attached to it, whereas there is less of a stigma with cannabis. You would not prescribe somebody X amount of Oxycontin knowing that they would be actually using it recreationally on top of it, because it will, of course, mess with the regimen of what you were prescribing. So there are a lot of very different variables that a doctor needs to keep in mind with respect to cannabis use and prescribing. And I'll follow up with what Jean-Claude said as well, is there certainly does need to be a holistic approach. And this is not exactly throwing a monkey wrench in the system, but it is most certainly changing the pathway to a system that doctors have been very, very, very streamlined doing, where they look at, say, body weight, appetite, severity of pain, all of these different variables, and then they fix a number and a narcotic attached to it. There's a certain degree of mathematics and systems that have checks and balances there. One, that's for accountability. Two, not to kill people. And three, to also save a doctor's license as well. So there needs to be these checks and balances. When you look at something holistic, there is no two people that are the same. And the way that people interact with the cannabinoids, it's completely different as well. When you start looking at all these different synthetic narcotics, it is far more predictable how the body is going to interact with these things. Now, what people don't understand is that if I have had a full meal in me and 10 hours of sleep, 5 milligrams of Dilaudid is going to affect me a lot differently than if I had 5 milligrams of Dilaudid with very little to eat, very little sleep, and a lot of stress. You metabolize these narcotics differently. So I think in full circle, we do need to take a lot more accountability for physicians and patients to have a more holistic approach and recognize that we're prescribing something that's going to be a moving target. No matter what, people metabolize narcotics differently, they react to narcotics differently, and this does need to be a pathway that needs to be ever changing, ever adapting, and just like our human bodies are. So this is certainly no easy task, but I do believe that an organic, holistic approach, again, an esteemed colleague of mine was commenting on this too, it's more work, but I think it's going to save the world from a lot more opioid addictions going forward, a lot more misuse of narcotics, and I do believe that we'll have a much more healthy society if we're able to start educating people on how to be able to react to different narcotics, on how to be able to understand what their bodies and their minds are doing when they are using these narcotics, and educate a doctor on how to be able to safely educate patients on using these narcotics.
Exactly that. And just to follow up, I really like the point Barander said about data and about how data is important. The thing is, and this is maybe a challenge that we have nowadays, we have so much data coming into physicians. And we have to remember, in medical school, what are you trained on? In medical school, you're trained to use this analog, stethoscope, these analog stuff. But then you go into real practice, and you have a computer, and all you're seeing is data sets. So ultimately, we need to find a way to help the doctors turn those data sets into actionable insights. You take actions, and based on what you're seeing, you understand it, and you know what prescription or what move or what's the next clinical judgment decision you need to take in the best interest of your patients. And again, it gets so complex, like Stephen said, it can get so complex, so you need to be ever adjusting, you need to be dynamic. So we need to ultimately give doctors the ability, not only when they're seeing the patient, but also after that, to monitor their patient and see continuously what is happening on many different spheres. We mentioned being holistic, so it's not just about what is happening on a maybe whether they're feeling good or not feeling good, but we need to have biological data. We need to have data sets which can tell us exactly what is happening in your body. And ultimately, just like Stephen said, when we start getting this right, the floodgates are open. And what we're doing, I think it's interesting, and being in the cannabis space, we're already getting one thing right. The first tick box is already there, because I think one of the biggest problems in mainstream healthcare is their rigidity not to explore these new things. So one of the things that patients like most about any cannabis clinic or any clinic which is offering alternative medicine is, I'm getting an alternative. In the old days, even asking for an alternative and you were shooed away from the clinic. What do you mean? You're talking about this kind of things. And now we have clinics which are actually offering professional guidance for alternative therapies. So this is already something which we're doing really well. And I don't know if this is a big statement, but I think that what we do in cannabis medicine will send shockwaves across medicine in general, because we're taking a different approach and we're starting with what the patient wants. If the patient wants to know about alternative therapies in a scientific way, and we're there to provide it, this will really have a big change, and we can do a lot for doctors warrants, especially if we want to get more doctors to be prescribing. You need to be safe, When I first got into cannabis medicine, I did very early, so I got disillusioned very early from the hospital setting. So definitely in my grade, in my year, I was the first doctor to venture out privately, do alternative medicine. And when I meet my friends in bars, and I can tell you a lot of young doctors, we certainly use cannabis, and we use, and a lot of doctors know the science. So it's not taught in schools, and there's no education, true, but doctors are inquisitive people. We research, we want to know. And many doctors, they say, it's not that I don't believe in it. When I ask them, come on, join my clinic, it's cool. And they say, I'm scared. I'm scared for my warrant. It took me 7 years and and a kidney to get here, and I'm not ready to go out and lose it all. So we need to give doctors, like we said, the confidence to go ahead and change the world for the patients.
Absolutely. I think what's unique to the cannabis industry is that, as you mentioned, teachings about the endocannabinoid system in the plant are not part of the traditional medical school. So the onus falls on us as an industry to educate the physicians or fight to have this kind of curriculum introduced to medical schools around the world. As somebody that has spent years in the field here in Germany, visiting hundreds of physicians, I can tell you it's difficult as a pharma rep or as a company to be the one to help a physician take that first step. They need to hear it from other physicians. They need to hear it from scientists. They need to hear the data, like you said. And I want to just touch on the point that you made, Julian, about the bureaucracy that's tied to it. When I was visiting physicians, really the one thing that convinced many of them to actually consider implementing cannabis was a tool that I was introducing them to that digitized the entire reimbursement process. And I think that's a great way of developing tech to ease the burden on the physicians and increase access. And I'm joined here by a number of industry colleagues that are implementing tech in a number of very different ways. So perhaps you could touch on the role that tech plays right now in making cannabis more accessible, but also with the recent innovations and technology such as AI and ML. Where is the integration of technology heading to further develop this market and make the access for patients more streamlined?
I think we always look at it primarily from an operational perspective. So where are potential hiccups in the patient journey? Because again, I think that's not only frustrating, but keeping people away or actually having them leave treatment because they're basically saying, hey, this is just too complicated. Before I was used to getting prescription and picking up on the next corner. That doesn't work in cannabis. We are very much data focused and in a way of having data from all these access points. So from doctors and their notes. I'm a radiologist originally, so I come from structure reporting, machine readable data. Same with the patients and prescriptions and also the pharmacists. It's interesting, I think, looking at data, it's crucial to zoom out more. So we look at data from more than 100 doctors and we use that data to educate them, because my personal experience in general medicine, but also in cannabis medicine, is that doctors overestimate their personal data that they collect and never step outside that, and then start to realize, okay, I could have treated that patient differently and the outcome would have been better. We've just finished first university collaborations, first paper being accepted, and we saw as a consequence of focus on operational focus, and that's where we invest a lot into tech and operations in the pharmacy, for the patients, in the app, for doctors. They have a better outcome. So our thesis is really, if you have a better operational experience, your medical outcome will be impacted. It's not just about the medication itself, it's about the journey along the way. And obviously we're getting into a direction of using that data not only to educate doctors, patients, pharmacists, but also making data-based suggestions. So for example, if you plug terpene profiles into that equation, into the algorithm, and you have all the data available from an analysis, so medical history of that patient, certain contraindications, certain indications, then you become very good at predicting not only is medical cannabis a good fit for that patient, but also which type. One of the, I think in German pharmacies, up to 200 different strains, that makes a big impact there. And then you can plug that in, because even the doctors with a lot of knowledge are asking for, how can I treat my patient based on terpene profiles and not just THC CBD ratio?
Innovation, I think, is going to be key for the sector. Innovation combined with combination products, I think, is just going to be the future. But looking at things like, how do we enhance bioavailability? How do we enhance solubility? How do we enhance stability? How do we get targeted formulations out there? Right? And that's something us at Brains Bio with our partners DSM Firmenich are really focused on the next horizon, and going beyond just CBD as a golden child. looking at CBN, CBC, major and minor cannabinoids, understanding what we can do and coming out with targeted formulations is going to be really key to the future. One area that really excites me also is sports science. How do we take all of our learnings, our clinical studies, and look at sports nutrition enhancement? Athletes travel a lot, we know that. Sleep is a big problem for them. Inflammation is a big problem for them. So how do we work on performance nutrition? And that is what innovation is going to bring to this. But also, innovation is what's going to help continue to bring down the stigma. When we could bring in new dosage forms, we could bring in dosage forms that are more acceptable other than flower and oils for people, that's going to help bring down the stigma, and it's going to be huge. I think innovation and combination products is something that I'm really looking forward to in the future.
It's interesting when we're looking at a holistic organic product and trying to incorporate technology into this. This is one thing that's rather interesting when you think of holistic medicine, something that I've heard many interesting stories from JC over here, and I urge you to spend some time with him hearing about his travels. Incorporating technology into these types of original traditional medicines is a big jump because you're looking at two polar opposites of the situation here. One instance where we found that we could introduce technology without kind of disrupting the actual natural course that this medicine has traditionally been used for, and where I have found it has been most beneficial, is with respect to actually using tech for accessibility. Not necessarily using tech to alter how you consume or how the product interacts with your body, but more or less using tech to be able to help with access. And in fact, Hello Cannabis was actually the very first clinic to be able to offer to be accepted into the OTN. The OTN is the Ontario Telehealth Network. So what this allowed was for doctors to be able to prescribe cannabis through a video conference call. And this was something that had tremendously helped our access because, once again, there were only 4% of physicians that were prescribing. Now, quite a few of those were actually working with us at one point, and it allowed us to be able to spread the access and be able to actually have them meet patients from around the province, which is rather large, I believe larger than Germany actually by size, and be able to increase access. Now, when a pandemic happened, of course, that technology was no longer useful because everybody had access to video. But what I do find is when we're able to incorporate technology that's going to be able to benefit a holistic and organic approach to a medication, to a traditional medicine, I think you can find like a happy sweet spot there. I don't think that cannabis needs to necessarily be going down a future tech hole, but I do believe that we do need to see some form of standardization with this product, a lot more consistency in utilizing technology for data, utilizing technology for education, utilizing data and technology for accessibility. And I do truly think that you can find a way to be able to harbor the future and have it work cohesively and collaborate with the past of traditional holistic medicine. And we can finally be able to get the best of both worlds. I don't think we are getting to the Terminator future with everything becoming very standardized and pill form. And I do think that we need to hold on to traditional holistic medical roots. I have found that as somebody that has a very strong daily regimen of medications required for chronic injuries, the traditional holistic route certainly allows me to be able to function and operate at my highest. And every other synthetic form, I have found that it has actually been an inebriation, and it has also been something that has kind of put me slower and unable to be able to perform at my highest ability. So finding the balance between technology and a holistic traditional, using technology and have that harbor with a traditional holistic medication, I think you're going to be able to see a strong, successful program with respect to cannabis. Unfortunately, no doctor is ever going to prescribe something that you well, let me rephrase that, please. A doctor will very rarely condone and prescribe something that you are going to combust and smoke in your lungs. That seems to be something that everybody here can agree on, I hope. But that being said, it is also an extremely fast and effective and controlled way to be able to get this medication into your system. So we have been able to find ways and use technology to be able to actually isolate the amount of cannabinoids that are coming in. And we have found different ways in order to be able to use this holistic medicine without having the subjectivity and irregularity of how much narcotic you're introducing into your body by utilizing some of this technology as well. So it's still kind of a weird faux pas when you start talking about high tech in the future with a very traditional holistic medication, but there is a balance. And my personal belief is that technology should be used in other areas outside of the actual indication to be able of the medication, use that technology to be able to help with data sets, to be able to help with education, to be able to help with destigmatization, to be able to help with accessibility. However, don't mess with something if it isn't broke. Cannabis is not a broken medicine. It works. And I don't think we need to really take this to the future and have this into a totally synthesized structure. Having a DID number would certainly help access, and it would certainly help destigmatize and get more doctors on board. But just as JC made a very strong counterpoint to what I was saying before, I don't believe it's taking a unholistic approach to any form of medication is the answer as well.
Exactly that. So at Celtex, what we do is we use biological data from an individual to assess and measure what is happening in an individual's body when using plant medicine. Trying to take plant medicine out of the shadows, out of this voodoo medicine shadows, which we're not comfortable with, mainstream doctors aren't comfortable with, and try to give them data from which they can make insights. They can take insights out of that and make, like we said, actionable decisions. But like Stephen is saying, it's not just about using it to measure biological data. Something we learned really early on is the tech is really a solution all across for different aspects. So Stephen mentioned some, I'll mention another. With regards to insurance, we've spoken about bureaucracy and how tech can help that. You mentioned that tool. I'll mention another, staff shortage. Healthcare is going through one of the biggest staff shortages ever since the pandemic. So I know there are lots of people from North America here. I have some numbers from there that even though 8% of all healthcare jobs are open at this point, we still have 400,000 less people working in healthcare in North America. So the same thing is in Europe, and wherever I've gone, it's always doctors are overworked, doctors are overtired. And if you remember, it jars with what I started with of giving patients the time of the day to encourage and foster that personal relationship and foster that trust. And I think tech can play a role here. By encouraging the patients to use tech and engage with tech, we can foster that personal relationship through tech despite the shortage of staff that we have. So really, it's about finding solutions for the different problems. And I think the most important thing, because it's an easy sell, right, finding solutions to problems, but we need to make sure that we're targeting all the stakeholders. So when we're developing tech, let's not just think about tech for patients, let's think of tech for everyone. So tech also for the industry to be able to allocate resources well. Let's think of tech for the pharmacists to be able to follow up, to be able to see, is their medicine working well? Are there any changes? Do they need to liaise with the doctor? And ultimately, I also believe that we need to look at data. I'm going to go back there. We need to look at data differently. And just like care has gone from institution-centric to patient-centric, it's the same thing with data. We need to empower patients, because it is empowering to own their own medical data. I don't know the last time you needed like a scan or something, but I needed a scan once from my hospital. You needed to go to customer care and wait 2 hours and have that burnt on a CD-ROM, as if anyone still uses those. And it made me think that patients really don't have access to their medical data. I mean, do you have access to the data, to maybe a CT scan you had when you were 10 years old? No, but it's your data, it's the patient's data. So I think tech can really serve to democratize data for patients, because once you empower patients to have that medical data about themselves, then they can be the ones, and we talked about this going backwards and starting with the patient, they can be the ones to go to the other stakeholders, to the industry, to the pharmacy, to the doctors, and tell them, this is my data. I'd like to share it with you. I'd like you to help me. I'd like to add value as a clinician, as a pharmacist. And finally, this is the product that I want. This is the product that works for my body.
Absolutely. I would just like to add on to that too, that tech can also help in the quality of data that's collected from consumers, especially now when you have, vaporizers, for example, that are connected to IoT. To basically have immediate data transfer on the usage of different medicines to kind of alleviate any kind of risk in the quality of data that you collect. And also, we didn't touch on this yet, but I think that, machine learning and AI and even blockchain in some instances are going to be absolutely crucial in expediting the process of finished pharmaceutical drug development. We have hundreds of products on the market in Germany and only 2 products that are actually market authorized. So I think tech is going to be absolutely crucial in developing these market authorized finished pharmaceuticals. Ladies and gentlemen, I am going to take the last 7.5 minutes, or this opportunity, first of all, to see if anyone in the audience has any questions for the panel.
First of all, let's hear it for the panel. Yay! Very exciting. You're also young and smart. My man Javier over here ran over. He's like, are they going to take questions? I have a very important question. So fingers crossed. Javier, what was your question?
Quick question. As an introduction, I'm a recreational user that takes a lot of cannabis every day. And at the same time, I'm a breeder. I have a partnership with some legendary breeders from Spain. And one of the things that I notice, because I'm very sensitive to the effect of what this thing does, because I also consume other psychedelics, as medicinal way, not recreational, is that a lot of some of the strains that we produce that are closer to the landrace cultivars, they're not as potent, but they give you a steady result. So my question is there anybody working on figuring out if all these fucking up with genetics that we're doing to try to provide the nice little terpene taste to the kids in California is messing up the medical industry? And is there room for the ones that we still, for the last 20 years, we've been keeping those clones and having weed that apparently is not desirable anymore, right? Is there room for a different type of breeding only for the medical business?
Stephen?
Yeah, if you don't mind, I got to tackle this one. That's an unbelievable question, and one that I've taken as a personal journey as well. My original hobby, being a Dutch guy from Vancouver and being exposed to cannabis since I've been since I've been this tall, was actually cultivation and genetics. Interestingly enough, I actually had the privilege to be traveling the world trying to discover some of these landrace strains. And in fact, I'm wearing a pendant from which was a gift from the Queen of Bhutan, which is a country in between India and China, where we were traveling in the Himalayan mountains discovering landrace strains. So when we talk about land races and how when we start catering and breeding and changing things for like different candy for kids and whatnot, let's look at dogs, for example, right? Like like a miniature pincer, like that is a dog that I'm not even sure has a brain. Right, like it doesn't even know its own name. When you start really genetically modifying things to the point where you are taking, quote, the best of one thing or, quote, the best of another thing, and continually breeding and manipulating them, you do genuinely lose the soul. I'm using that word very frivolously, but I hope everybody in the audience can kind of follow what I'm meaning by that. You are right. You definitely lose the landrace strains certainly do not have the potency, which is what all of these breeding programs have been trying to do. But the most important thing that they have been losing is the actual medical benefit. We have found that landrace strains have certainly had a far stronger entourage effect and cannabinoid effect with respect to holistic medical therapy. And I do believe that the further we are manipulating these landrace strains, the further away we are getting, the further we are getting away from an actual holistic, original medical approach here. So the balance between that's going to be very interesting. And yes, I do believe that we need to pay homage to some of the original land races and the growers. And I'd love to talk to you about some of the programs that are there. But again, introducing that type of stuff to doctors is going to be extremely challenging again because of the organic aspect of it. Most of these landrace strains are consumed by combustion, which is not exactly something that's condoned by doctors very well. It's a very big moving target and one that I think you and I should have a private chat over. I would love that.
Just to add something small, that was bang on the mark, Stephen. Great question. Just to add this note to all the audience, however long humans have been playing with cannabis genetics, the land races have been evolving with humans for hundreds of thousands of years, for millennia. So if that isn't the most, I think nature has been playing around with genetics much longer than anyone else, and we need to keep that in mind.
Any other questions from the audience? We have a couple more minutes.
Very comprehensive. Oh, wait, I had a question, but I forgot it because I hit some hash while you were talking earlier.
Same.
So it was because you were talking about as we've been evolving with weed, weed's been evolving with us. So would you call some of these new weeds like a junk food? Or would you say that it's just further evolution because young people like sweeter things? And you know what I mean? Because everything tastes like a dessert. All the old heads are always like, bring back the weed that tastes like feet and cheese and burnt tires and a skunk. But all the kids are like, we like the Skittles and the candy. And then, right, when was the last time you had a coffee flavored weed or a wine flavored weed? Would you say that's just part of the evolution? Or would you say that it's more of a bastardization?
I think it depends on what you're doing with it. At the end of the day, it's medical. If it's recreational, then whatever tastes fine is great. But if it's medical, the human body is the way it is. So it changes very slowly, and it doesn't adapt as fast as modern society, or especially not as fast as the industry changes and adapts. So whenever we come up with new strains, especially I think in the medical sector, we need to keep that in mind, that if something is new and we're going too far away from what is natural, we need to keep in mind that there's a question mark. Not saying it's bad, but we need to remember that we don't know. We're not sure.
I think we're just always saying to challenge why is it recreational versus medical. So if you look at data from the US, you see that in a recreational market, 45% of people actually self-medicate. And they're not fully aware. So when anybody says, hey, this is rec and this is medical, I always ask, why is it rec and what are you doing in there? And then suddenly they start to say, well, I'm sleeping better, I have less anxiety, etc. Yeah. Those are medical indications. And that's also from a doctor a challenge, I think as Stephen also said, to be open about that and ask those questions. But suddenly you see patients uneducated about their own diseases.
Yeah.
I don't know a single cannabis consumer that says, I do it because I like getting messed up. Right,
sometimes I like to be high as hell. I'm not going to lie.
That's totally fair, but I believe that there's a medical reason that you were doing that.
I was probably sad.
There you go. So there's a perfect example right here where that is self-medicating, right?
All cannabis use is medical use, according to the late great Dennis Perone. He would say all cannabis use is medical use. I tend to agree. We are unfortunately out of time, but that was fantastic. Thank you all so much.
Thank you.
Let's hear it again for this fantastic panel.